20 minutes.
Thank you very much. I am Dr. Lesan Joel, Senior Director Clinical Services, but now the acting CEO in Kenyatta National Hospital. In terms of fistula, obstetric fistula care in this hospital, we are a running referral hospital. We run 24-hour day services, 365 days a year, and we do both training for the management of obstetric fistula and treatment of the same at all given times. All our patients have access to the services either through SHA or sponsorship from other our partners, or even through the hospital social work itself.
You in a field? You don't okay. Yeah, she's a partner, exactly. Yes. Childbirth is at the core of our mandate, so we work supporting the Ministry of Health and the different partners in ensuring prevention, treatment and social integration, and we support especially fistula repair efforts through AMPREP and other channels. So every year we support the fistula camp, but also we support the institutionalization of routine fistula services. One of the key prevention interventions that is evidence-based is family planning, because when women plan their pregnancies, and especially when we are talking about young women, that they are very young girls that get pregnant, they very likely to have obstetric labor. And so family planning is one of the key prevention interventions that we support, in addition to, of course, FGM. FGM is also one practice that could end in obstetric fistula, and of course sexual violence. So we support all prevention efforts, but also treatment and rehabilitation. So at the UNFPA we support life skills education to ensure that young people have access to age-appropriate sexuality education, and of course we are now the leading partner supporting the government and stakeholders in the procurement of modern family planning commodities. But as we know, there is a very challenging arena now, because we have some reports in stockouts of family planning commodities throughout the country. So we need to all together put efforts to ensuring that there is domestic resource mobilization for family planning, so the government can take up this very fundamental program, and hopefully we will see that every woman that wants to have access to the modern family planning, she can choose the method and she can continue using the method without having stockouts. Yes.
First of all, my office is not the one that will be able to identify. We can create awareness, right? So with my 1.4 million followers online, we try to create awareness on this campaign. But for me, what's happening is we've got CHPs. As a government, we've provided for CHPs across the country. There are over 100,000 of them. And they actually manage specific households. So once they're educated on what are the symptoms of fistula, then they can actually help the family seek healthcare interventions. For me, a woman who already has fistula is suffering in silence. And she loses her marriage, she loses her dignity, she loses her neighbors, her friends. So when the CHPs go there, I think that's the first point of intervention. All neighbors will get to hear. I mean, Sharon saw it on Royal Media. One of the ladies that we met in the clinic today, she got an NPS, she got a Safaricom message telling her that there was a camp going on. So creating awareness. Everybody is online. I want to tell the people that are online, create awareness on interventions that are positive. You know, we can't always hate. We can always look for solutions. Every problem can be solved with a solution, not with an insult. So for me, I believe that what Kenyatta National Hospital has done with its partners, and we have to commend the M-Pesa Foundation, has been commendable. We have to commend all the doctors. You know, for me, it's all the parents and all the doctors who went through this education to become specialists, to be able to give this service to Kenyans. You know, it's Kenyans working hard to serve other Kenyans, and the government providing an enabling environment where people can actually use their knowledge and their education and their experience to find solutions. So I celebrate the survivors that shared their story today, Sharon and Nifa, and I celebrate the husbands. You know, when you hear Yambo saying that he was celibate for 4 years because he couldn't have intimacy with his wife, but for 4 years he stayed with her because he knew that it was not her fault that she ended up with fistula, and they worked together to find the solution. I wish they had found it earlier, but now we're creating more awareness with social media, with the partners that we have. The media can play a very big role in ensuring that Kenyans get to know. But more important, I think our CHPs, when they go household to household and they get to hear about, they know the conditions that one would have if they have fistula, they will be able to direct them to come to Kenyatta National Hospital, and there are other facilities that have been shared across the country. We need one we need a doctor a specialist in every county. We don't have that yet, but we're getting there, you know. So I celebrate what we have, and we work hard to provide what we don't have. So I think you should talk to the survivor here. You've talked to her already? Nyla is...
You can still talk to her.
Yes.
You can still
Okay. So Nyla is a friend of mine, young girl that I'm mentoring. She is actually from Narok, but her husband was a politician, Dr. Ngeno, Honorable Ngeno, Yohana Ngeno. He was the chair of the Housing Committee, and he passed on. And she wants to be able to serve. So she asked me, when I'm in Nairobi, can I join you in any excursion or anything that you're doing? So I invited her today. She walked with us, reflect the walk. She's gone through the wards, she's seen. So, let her tell you what she feels.
First of all, I want to thank Passaris for having me here today. And when I came here, I didn't know how educational this was going to be. And coming from a county that puts so much in FGM and women empowerment, I feel like we don't put enough in fistula awareness. And today I stand here on behalf of the women of Narok to create awareness for fistula treatment. Na pia ningependa kuwaomba wamama wenzangu kutoka mashinani wajitokeze kwa wingi wapimwe fistula, kwa sababu tumeona leo fistula iko na tiba, na tunawashukuru viongozi wetu ambao wanatusaidia. Madaktari pia tumeambiwa wako katika kila county na wanaendelea kutusaidia katika create awareness kwa fistula.
Now, Naila, one of the problems that we have in your county is early marriages, children getting married. I know we still haven't combated that. So you've understood, first of all, there's family planning, but also young girls getting pregnant very early. And then we've also seen FGM also increases the chances of fistula. So now that you're going to go back, when you go back home, what's the plan?
First of all, I want to say that yes, we have taken so much of FGM, and we have also a lot of early marriages still going on until now. But I will go home and create awareness on this. And now when girls, when they get married, they get children, and you have been told that when you plan for your families, you don't have to get pregnant all the time. When you have family planning, we're going to move forward as a county.
Full name?
My name is Nayemi Tutumen.
Great. Young And yeah, it's good when the young leaders now. She's going to be a young leader. She was married to a politician, very astute politician called Kingpin in Murua Kikir, and now she's going to be able to continue his work. She wants to figure out, you know, what can I do for the people. My husband was there in the front line. Now I want to be there in the front line. You should have seen her recently. She was really out there campaigning for the candidate, and the candidate won. So I'm proud of you.
Maybe what I would say is to wind up that is like we need
Let her your mic, where?
if the media can
Let her mic. Let her mic.
without my
Come here.
no, nothing much really, but just to really thank the Office of the Women and who have really come through for us even as women in Fistula. We have a voice. We are appreciated. We are so I really want to appreciate. On top of that, we need to normalize conversations for this thing. Not only do we have these conversations in the international day to end up why don't we have it 365 days a year? Why don't we have different stories? We have 100 years of the foundation, others from different counties. Real, from middle class all the way to high class and low. You know, and these stories, the more they bring it out, the more we normalize conversations. Because I come from a community where, when I speak about Fistula, they go like, family, like literally I'm embarrassing my own family at home. So we need to normalize by having these conversations as regular as possible, and we already have a support system from the Ministry of Health. 100% supportive. All our partners here have been supportive. So let's move to the level where, as Fistula survivors, we are hard. And as Fistula survivors, they have a foundation, Save a Woman, Fistula Foundation. I have a foundation, Save a Woman, Fistula Foundation. That was birthed out of my experience with Fistula.
But let me tell you, I mean, I became woman rep, and the only way I got to know was being invited for a fundraiser dinner. And I had no idea what it was about. Naila today had no idea. It was a learning curve for her, right? I think now we need AMREF here, because AMREF and your community health promoters, come, tell us. Tell us more. Let AMREF come here and talk. Dr. Ari. So to party 5 minutes, let's say 1 minute. Yeah, go.
All right, my name is Dirango Njoki Meshak, Country Director of AMREF, and very much honored to join on Passaris and the partners here, UNFPA and all the other partners being hosted here at the Kenyatta National Hospital. First of all, we congratulate Kenyatta National Hospital for the leadership and the Fistula work across the country. Kenyatta National Hospital has led by example for many, many years, training a lot of the experts that have helped take Fistula care to the grassroots. But to feed on to what Honorable Passaris has said, the success of the war against, or rather the journey towards eradication of Fistula is dependent on a few things, and we are winning as a country. One is the whole aspect of partnership and community engagement. We have seen amazing work being done by community health promoters. Remember, in Kenya we have more than 100,000 community health promoters, and they are able to visit households and pass the message that if one has symptoms that suggest it could be fistula, like leaking urine, they can go and seek care at the nearest facility. But we must also acknowledge that they are also being supported by so many other people, Safaricom, who are able to pass the messages through the phone, the Safaricom network, so that women can get a message, a very personalized message saying if you have this problem, come and you get care. But also media houses, we must celebrate media houses like Citizen TV and the others who have done an amazing job in spreading this word across the country. So we truly celebrate, as AMREF of Africa, we truly celebrate that spirit of partnership and community, and really working also with the survivors. And as it emerged today, sometimes calling them survivors is an understatement. It's really victors, it's really ambassadors, because like today we listened to the amazing story by Sharon and Nifa, who conquered the fistula. They had fistula, but you can see they have gone on to tell the story. They have gone on to be ambassadors of what is possible and spreading the word that this is treatable, this is curable. Just before I finish, allow me to also appreciate that money matters, and we celebrate that the Social Health Authority did some time ago allow fistula to be reimbursable. and that has made it a lot easier for our facilities as they offer surgeries. They get a reimbursement from the social authority. So as Honorable Passaris has said, let's keep celebrating these gains we are making as a country. Other than that, I think the only other thing I would like to really highlight is we really need to create demand from what is happening here, from the work in National Hospital and the work that the Ministry of Health has done in the counties. We have enough expertise in the country now to provide fistula care. We have amazing partners and support from the political class. What we really now need to do as media houses and as partners is to let citizens know that fistula is treatable. They come forward and get treatment. Just before I finish, one other thing is a reminder that every person, every woman who has fistula represents a mother, a woman who could have died, because fistula is usually caused by obstructed labor. And out of every couple of women who have fistula, one will die, because obstructed labor does kill women, in addition to other problems like bleeding a lot during birth, delivery. And so that unfinished business of closing the tap that leads to fistula is very important to close, working to ensure that all women deliver in a health facility that has skilled the birth attendant, and we do not have deliveries at home. So again, calling all women to deliver, all partners to work with everyone so that women deliver in health facilities where they can get the expert care that they need. Thank you.
Okay. Dr. Serembia, Ministry of Health, wacha zungumze. Yeye ndio anatuhost leo.
Yes. Thank you. Thank you very much. Thank you very much. My name is Dr. Saram Edward from the Ministry of Health, from the Division of Reproductive Maternal Health, and I'm pleased to join this team today as we engage on issues of fistula. And when we talk about fistula, it's something which should not be happening to our women, because that was service delayed or denied. So with that, we all call upon all our partners, all our leadership, so that they can come together. Because when we talk about delayed, means that woman could not get to the facility. And if she got to the facility, she didn't get the right treatment or care. So that's some of the bottlenecks which we still have at the Ministry of Health. And we do trying as much as possible to make sure that we address those challenges. From our end, we have come with the guidelines, making sure that yes, this is how you prevent, this is how you treat. The other thing which therefore is very important is getting resources to make sure that women don't have to delay access to services. And those also require resources. I must say, from the Ministry of Health and the government of Kenya, a lot of things have some resources are being earmarked, and we are looking at those counties which are heavily affected. 26 counties are already being identified where we have the highest burden, and resources are is going to be given. Very soon, there is what we call every woman, every newborn, everywhere in our country. It's a launch which is going to be done by the President, and most likely it will happen next week. And this one is to sensitize the public, to bring the leadership on board, because the care and running of the healthcare facilities is purely the duty of the governments. As we provide guidance and we provide policy direction, but we want the governors to honor and be accountable to the health of women. One thing which is there, one of the strategies is to make sure that we train more physical surgeons. We don't have enough as of now. Yeah, and we would like to make, we want to encourage the county governments and even, with the training institutions so that we can train more. That is our goal, to make sure that we train more. With, together with the partners, together with the partners, we work together, and I'm happy that we have partners who are here and they have been supporting this process. That whenever we, whenever we want to address the issues of fistula, we do camps. Yes, because we have been doing camps all along. Yeah, we did the other one in Kisii the other time, and because the fistula cases isn't that there are very many more, and it's also one of the conditions which is stigmatized, as has been said. So most of the ladies don't come out, but we are doing it. From our statistics, we have almost about 3,000 women every year, and we would like to make sure that we address that. SHA is comprehensive. Yes. So far, as we roll out SHA, one of the benefits package which every woman should receive is even including fistula. So it is comprehensive. I really don't have a situation where we can say a woman has been denied services because of SHA did not pay. So it's part of the package.
Tomorrow is the actual day. Today is, we did it today because it's Friday, right? The camp was running from Monday. So tomorrow is the International Day for Fistula. Do a documentary with everything that you have, do your research, and let's spread awareness tomorrow. And remember that Kenyatta National Hospital, every Monday, you come in, get screened, and then hopefully get scheduled for the surgery. Fantastic. But tomorrow, we are kesho.